When you're in trouble, who do you call? 911. Who shows up? The paramedics. I'd like to tell you a little bit more about paramedics and the schooling they have to go through. To become a paramedic, you must first become an EMT, an emergency medical technician. To get to this point, you have to go through the first responder class. This class is 3 months long and consists of basic life support, basic airway management, CPR, and patient assessment. After passing this class, you have to apply into the EMT program. This program consists of another 3-month-long class. In this class, you will learn basic airway, basic life support, CPR, patient assessment, and knowledge on a few drugs like nitroglycerin, oxygen, and aspirin. Once passing the EMT class, you have to go through the NREMT, which is the National Registry of Emergency Medical Technicians. Pass the written and practical tests to get your certificate. After getting your certificate, you have to go through the paramedic program. This program in the local college is very competitive. It consists of a class that is 11 months long, rigorous training, 450 hours of ride-along time on the ambulance, 150 clinical hours, and grueling exams. Paramedics learn advanced airway support using an endotracheal tube, advanced life support, how to run a code or cardiac arrest, learning the doses and uses for different drugs, and gaining confidence on what you're doing. Paramedics have no one to rely on to tell them what to do. They have to make their own decisions in a split second. Paramedics respond to many different calls. These calls can range from a basic foot pain to cardiac arrest. Depending on the different calls will depend on the kind of care that each patient receives. The distance between the patient's location and the hospital is also another determining factor on the care that the patient will receive. I personally have run my own code, and this was a very difficult and grueling process. When we pulled up on the scene, the patient had collapsed on the golf course. This patient was blue from the neck up, and he had no pulse. We started CPR, we started pushing epi, and all the other drugs needed in advanced life support. We were never able to get a pulse back, which was very difficult to deal with. A lot of times paramedics have to deal with death in their own way. My personal way was talking to someone. I was able to talk to my preceptor and really get through it. Paramedics also have a very grueling schedule. They go 24 hours on, 48 off. Being 24 hours away from your family can be very stressful. Paramedics are very fortunate. Their job is very rewarding and it's very expandable. Paramedics can do the transition program into nursing. They can further their knowledge and do aeromed, or even go further and become a doctor. The training required to become a paramedic is also very rewarding. You're able to make your own decisions. You're able to know exactly what to do at every situation, every diagnosis. It's a pretty difficult task, but with the proper training, it's pretty accessible. So paramedics, their schedules are pretty crazy. They learn a lot of different drugs. A lot. There's about 50. They go through extensive training. It's a very long process, and I would like to say that it's pretty rewarding. I've gone through it myself, and it's stressful. It's extremely stressful, but it's worth it in the end. I'm really glad that I did it, and I hope that this information it was helpful. Thank you.